And with us now is the president and CEO of Hartford HealthCare, Jeff Flaks. And Jeff, good to see you back here in the program.
Thank you.
So first of all, let's talk about this report card from Leapfrog. Tell me about it.
That's amazing. I'm so happy, so proud, and for the state of Connecticut, for Hartford HealthCare to have an A at every one of our facilities from Leapfrog is just a validation of the world-class healthcare, the safest and highest quality healthcare here in Connecticut, really provided to all of our residents.
So I'm picturing a bunch of experts going through the hospital, looking under beds and stuff. What do they do? How do they come up with this
Leapfrog, it's the gold standard. So it assesses all of our institutions across the country, and it looks at morbidity, mortality, hospital readmissions, resurgerization rates, quality and safety scores relative to injuries, the quality of outcomes relative to emergency departments, and it gives us a grade. And for each one of our facilities to score at the highest level, we're really amongst only a few health systems in the country who's ever achieved this.
And as you go through some of the facets they look at, what are some of the categories?
Well, it's very interesting. I mean, it really looks at all the quality scores around nursing. It looks at quality scores around our physician services. It looks at our surgical services. So it's a comprehensive assessment, really looking at each one of our facilities across a whole series of metrics that ultimately gives these types of designations and grades. And it's a special moment for Hartford HealthCare.
And how does this play into the future of Hartford HealthCare?
Well, look, our purpose, our mission, why we exist, it's about quality, it's about safety. I'm so happy. Think about Connecticut. We're third in the country ranked today for access. We're fourth in the country ranked for overall quality of healthcare. Dennis, I talked to the governor about this. You drive down the highways in Connecticut and you see we're the pizza capital of the world, we're the basketball capital of the world, the insurance capital of the world, all things that are near and dear to my heart. We're also the healthcare capital of the world.
People often pick a place to live based on taxes or maybe the weather or job opportunities, but healthcare really should figure into that because some parts of the country don't have access to healthcare like Connecticut does.
We're part of the fabric of this state, the health, the well-being, the vitality, the economic strength of the state. So healthcare is part of the underpinnings of the state. And across Connecticut, we have so many great health systems, so many great healthcare organizations that collectively, we really make Connecticut a great place to live, raise families, retire, even receive end-of-life care. I mean, this is a destination.
I want to talk a little bit about the medical mission. You mentioned the word mission earlier, and you had 7 locations a couple of weeks ago, and I had the privilege of coming in and just witnessing what happened. So there are about 4,000 volunteers.
Yes.
What kind of things did you learn from this event, and what kind of, well, I know in years past there's been some life-saving missions right then and there.
It's the best day of the year. It truly is. So we had 7 locations ranging from Bridgeport to Meriden, New Britain, Willimantic, Torrington, Norwich, Hartford. Really exceptional. 4,000 people volunteering to provide all ranges of healthcare services. We give out thousands and thousands of winter coats, boots, haircuts, podiatry care, foot washing, dental care, orthopedic care, medical physicals, laboratory results, medications, all free of charge, including hot meals. And we get people ready for the winter safely. We give them provisions, and we give them health checkups, and we get them connected to healthcare. So it's an important day. We do it every November, the first Saturday in November. We're thinking about even expanding it to more times during the year because there's so much need. And this is one way to ensure that, again, we're connecting to the community better.
I know it's early and you're probably still going through the data, but what did you learn from this year's that you might make different next year?
First of all, it shows there's so many people in need. There's so many people we can help. And what's important to me is it's not a moment and it's not a transaction. Every person who comes to us, we work to get them connected to our family health centers, to community agencies who partner with us. We get them enrolled in the Husky plan and Medicaid services. We get people connected to our providers and our primary care physicians. So really what we learn is there's too many people, right, who don't have that connectivity to the healthcare system. So our job in this is to capture people and ensure we give them that coordination and continuity of care.
I want to touch on that just a little bit. For our viewers who may not have health care, what's your advice to them? What can they do?
Well, there's so many places to go. Our family health centers, our community health centers across Connecticut do an exceptional job. So to me, there are many ways, and there's many opportunities. The state has great safety nets and provisions in place. And of course, every hospital in the Connecticut, our emergency departments are always there to care for people, our urgent care centers. So we're building more and more access, and it's so necessary. We need to be closer to people's home. We need to be closer to where people live. And today, we do things like neighborhood health, where we dispatch every day medical teams in caravans that go to homeless shelters, that go to community centers.
He is the president and CEO of Hartford HealthCare. Jeff Flaks, thanks for being with us here today.
My pleasure. Thank you.
It's beginning to look a lot like Christmas in Connecticut. That story when we come back on this Sunday morning.